impact and empowering local partners makes our global investments more sustainable, effective, and equitable. USAID's goal is to dedicate 25% of funding to local partners by 2025, with a longer-term goal to incorporate local voices into at least half of agency programs.
When you are a local partner, you have a possibility or you have an opportunity that outside partners may not have, because you know the ground, you know the field, you know where to invest, and you know where you could channel most of the resources, to get the result that you're expected.
USAID's commitment to advancing localization supports an HIV response that is owned and led by partner governments, communities, local partners, and people impacted by HIV, a core principle of the President's Emergency Plan for AIDS Relief, PEPFAR. As a key implementer of PEPFAR, USAID is helping local organizations to achieve country ownership and long-term sustainability of the HIV response. In 2022 alone, USAID funded $853 million to more than 150 prime local organizations. Direct funding of local partners is critical to foster creativity and innovation in HIV programming. Listening to local voices, health workers, faith leaders, advocates, community leaders helps achieve better HIV outcomes.
Being able to elevate the voices of communities. So everything that is a positive change in terms of medical reform, in terms of access to treatment, is actually driven by the communities.
Local partners are essential to maintain treatment continuity, reduce mortality, and improve quality of life, all vital to sustaining HIV impact and long-term sustainability of the response.
There cannot be sustainability without local NGOs. When a project stream ends, we stay and continue the work. And so sustainability is not simply a question for us, it's a given.
By funding local organizations and elevating local voices, USAID is helping to create a future where local partners can achieve sustainable, effective, and equitable outcomes.
Locally led development is the key to delivering the kind of results that will be visible years and years in the future, long after our programs have wound down.
Yeah, let's clap some more. That video was fantastic. Thank you very, very much. Welcome. Saubona, benvindo, bienvenue, bienvenidos, bisimila, karibu sana. Tried to get as many as I could. We are so thrilled to welcome all of you to our 4th annual local partner meeting. It is truly wonderful to be back together in person for the first time in 3 years. And as you can see, we are a much larger group than 3 years ago. I know you all started in different sessions this morning, but now that we are officially kicking off our local partner meeting, where we will spend the next 3 afternoons together, we will share experiences, knowledge, email addresses, meals, and many, many delicious snacks outside, all for the same purpose of continuing to build our community together. Before we continue with further welcoming remarks, I just want us to take us through a few introductory points about this week and the services available to make this week the best possible meeting yet. I was going to say next slide, but I can do the next slide. Okay. The notes are not here. Okay, anyway. Whew. So this is the week at a glance. We will be having 3 sub-meetings. In the mornings, our global HIV strategy discussions will happen with our USAID colleagues across the way in the Aurora rooms. our local partners will be conducting various trainings throughout Tuesday, Wednesday, and Thursday. And then in the afternoons are when we will be having our local partner meeting with everyone. So we have another room in the Aurora room. So anyone standing in the back who doesn't have a seat, please feel free to go into our overflow room where we have a variety of other colleagues. And also, yes, thank you for the sir who's waving. So if you are sitting towards the end of the aisles, if you could maybe scooch in so that our colleagues can come and get seats that might be coming a little bit later. So our afternoon sessions will be plenaries, panels, posters, and our feedback sessions. Translation services are available in French, Portuguese, and Spanish. So if you require translation, we have headsets back in the lobby. Please go and take those headsets. We will only have them in the afternoons, but we wanted to make sure that we included them so that everyone can participate in as many of the languages that we offer. So I'm going to pause to ask you all to take out your phones and take a picture of this phenomenal QR code, because where this QR code will take you is to the abstract anthology for this meeting, where you and your organizations have submitted over 200 abstracts from work done across the globe. It is a 4-time increase from last year's meeting. This week, we will be highlighting 39 different partners across 20 different countries in 16 panels. 109 posters will also exhibit your tremendous work. So this QR code will take you to a PDF that is, I think, 140 pages. So you can search by category and read all about the work you and your colleagues have submitted to make this week the best possible, technically excellent week. As I mentioned, we will be presenting 109 posters from this afternoon, tomorrow afternoon, and Thursday afternoon. Here are the different categories for when the posters will be presented. I'm sure many of you saw the posters that were posted already. Posters will also be available virtually on the conference platform. So you'll need to go to the platform or through the app and you can see all of the posters there as well. I strongly encourage you to take a look at the posters this evening. Many of the authors of the posters are here and very keen and eager to discuss their work. So please go and support your local partner, your fellow local partners, and learn from their experiences. We also will be holding office hours this week, which is your time to ask individual questions to USAID's operational offices. We will be holding them every evening from Tuesday, Wednesday, and Thursday. Offices that will be represented are the Office of Acquisition and Assistance, the Office of Financial Management, our Communications Department, and the Office of Inspector General. So this is a time when if you have individual questions that you don't feel comfortable asking in plenary, feel free to go. We will have a variety of staff in those office hours ready to answer your questions. We also will be having feedback sessions on Thursday from 1 to 3 p.m. This is the opportunity for local partners to provide feedback to USAID. So in our introductory email we sent out a few weeks ago, we highlighted the different sessions that we would hold, which are listed here on the slide. We will be having 6 breakout sessions. 4 of the sessions will be facilitated in English, and then we will have a French room and a Spanish and Portuguese room, where that is what the facilitation and all of the discussions will be conducted in those languages. Local partners will select which room you would like to go to on that day. We might be at capacity in some rooms, so please be patient with us. If there's a room that you would like to go to that is full, we really ask that you go to another room to continue your engagement there. And then we will close our local partner meeting on Thursday with our closing plenary, which will include a high-level report out from each of the feedback sessions, and then responses from our USAID leadership that are here with us. Security considerations. Please make sure that you are wearing your conference badge throughout the week. Guards will be periodically checking and will not allow you into the sessions without your badge. Also, for security, please do not wear your badge outside of the hotel. We do not want folks to know that we are having a giant local partner meeting at this hotel. Please also monitor your valuables and don't leave anything unattended. For many of our sessions, we will need to be standing out of rooms, and we need to bring all of our belongings for them to change the walls and all kinds of fun things. So please always have your valuables on you or know where they are. Our Wi-Fi connections for this venue, which many of you likely already have. So the network is the capital Connect, and the password is ConnectMe, all in one word. So I want to wish you all a very, very wonderful week. We're really, really excited to have you all here. Like I said, we have so many partners from so many different countries. So thank you very much for all of your time and your travel. I know many of you traveled from a very, very long way. I believe we're waiting for our next speaker. So I'm going to, maybe we can put some music on or something, because I keep looking and they're not quite ready yet. So maybe I'll see if anybody has any questions. Oh, yes, thank you. So we will also be having a reception this evening at the hotel. It's going to be just over by the pool from 6:30 to 7:30 p.m. And that it will be an informal time to network and socialize. All of our USAID staff who are here as well will also be participating. So if you wanted to expand your network, ask questions, or just meet new people, that's the best time. It will be cash bar, and there will be food available. Anything else I should add? Okay. Sorry. No matter how much you plan things, they never tend to go exactly how you plan them. Am I right? Okay, I'm going to step off and maybe see where everybody is. Thank you very, very much. We're really excited for the rest of this week. Thank you for your patience. And it looks like our next speakers are coming, so I will maybe just stand here. Sorry, if we can all please stand. Thank you. Thank you. Thank you very much, Ambassador. So it is now my esteemed pleasure to introduce our next speaker. Melissa Jones is a Senior Deputy Assistant Administrator for the Bureau for Global Health. Prior to this role, she served as the Director of the Office of Country Support. Her public health career spans 3 decades, with areas of expertise in infectious diseases, maternal and child health, nutrition, health systems, and education. Over the past 15 years, she has served in senior leadership positions in countries in Africa and Asia, overseeing a broad spectrum of health and education programs and leading large and diverse teams of development professionals. She likewise has played important roles in U.S. government interagency and multilateral coordination. Melissa is also a true champion of our local partners, and we are so thrilled that she could join us today. Melissa.
great to be here, and thank you, Lindsay, for the introduction. I, too, have the privilege to introduce the ambassador for South Africa. Ambassador Reuben Brigety II was nominated by President Joseph R. Biden on February 10th, 2022, to be the U.S. ambassador to the Republic of South Africa. He has served as the 17th Vice Chancellor of the University of the South and Mayor of Tshwane from June 2020 until December 2021. Previously, he served as the Dean of the Elliott School of International Affairs of the George Washington University. I'm going to continue. This is such an impressive bio. Ambassador Brigety's most recent diplomatic assignment was serving as the U.S. representative to the African Union and the U.S. permanent representative to the UN Economic Commission for Africa from 2013 to 2015. Previously, Ambassador Brigety served as the Deputy Assistant Secretary of State in the Bureau of African Affairs and also the Deputy Assistant Secretary of State in the Bureau of Populations, Refugees, and Migration. He's a native of Jacksonville, Florida. Ambassador Brigety also held appointments as the Assistant Professor of Government and Politics at George Mason University and at the School of International Service at the American University between August 2003 and April of 2009. In addition, Ambassador Brigety was a researcher with the Arms Division of Human Rights Watch from August 2001 to May of 2003, where he conducted research missions in Afghanistan and Iraq. Before joining HRW, Ambassador Brigety was an active duty U.S. naval officer and held several staff positions in the Pentagon and at the Fleet Support Units. I'm going to continue. Ambassador Brigety is a 1995 distinguished midshipman graduate of the U.S. Naval Academy, where he earned a BS in political science, served as the brigade commander, and received the Thomas G. Pohnall Scholarship. He also holds a master's in philosophy, a PhD in international relations from the University of Cambridge, England, as well as a Doctor of Humane Letters from Old Dominion University. Ambassador Brigety is a life member of the Council of Foreign Relations and a recipient of the Council's International Affairs Fellowship. He is a member of the Board of Counselors for the McLarty Association, an adjunct senior fellow to Africa Peace and Security at the Council of Foreign Relations, and a fellow of the American Academy of Diplomacy. When President Biden wanted an ambassador for this incredible country, he chose the best. Ambassador Brigety believes that USAID is essential to our mission here in South Africa and what he likes to call Ubuntu diplomacy. We are thrilled to have him with us here today, and I'm honored to be in his presence. Ambassador, the stage is yours.
Sawubona. Melissa, thank you very much for that kind and overly generous introduction. When my father hears that read, he's like, that boy can't seem to keep a job. It's an honor to be here with all of you today, both here physically present and also those of you who are online. Thank you so much for making the effort to be here in Johannesburg and also for making the effort to be with us in cyberspace. As Melissa said, I believe that the concept of Ubuntu, I am because we are, is one of South Africa's great gifts to the world. When I had my Senate confirmation hearing, and when I presented my credentials to the head of state, His Excellency Cyril Ramaphosa, I committed myself and the U.S. mission here to practicing Ubuntu diplomacy. And I believe that USAID is the Ubuntu agency of the U.S. government. And therefore, all of you are so deputized in this mission. To all of our guests arriving from around the world, it is my pleasure to welcome you to South Africa and to this conference, hosted by USAID and by the U.S. mission to South Africa. It's an honor and a privilege to have all of you here in South Africa, and I hope your time in Johannesburg, in Jozi, will be productive and eye-opening. I want to express to all of you my firm overall commitment in alignment with the Biden administration to achieving the 2030 Sustainable Development Goals and advancing equity and inclusive development. These commitments echo those made by my friend of long-standing USAID Administrator Samantha Power when she said in November 2021 that she had to achieve two ambitious targets. The first, that within the next 4 years, 25% of USAID's assistance will go directly to local partners. And the second, that 50% of USAID's programming will be led or driven by local communities and local voices. The US government has a long history of working with local partners from across the Southern African region. So it is fitting that South Africa is hosting this event, which I understand is potentially the largest convening of local partners that USAID has ever organized. Absolutely, give yourself a hand. You know, the challenge, of course, with it being the largest is that now you have to like top that next year or next time, right? So it's always a goal to achieve. As part of the U.S. government's commitments to sustainability and localization, U.S. health assistance is increasingly investing in local organizations and systems, not only in HIV and AIDS care and support through PEPFAR, but also with our COVID-19 support and investments in addressing global health security. In this regard, our investment in South Africa is one of our biggest success stories. We are proud that over 80% of our health funding goes directly to local South African implementing partners, leveraging local expertise, building enduring partnerships, and creating jobs in the South African economy. This includes partnering with the government of the Republic of South Africa through investments in healthcare, education, and social services at the national, provincial, and district levels. It is this direct investment and these partnerships that enable our success in addressing our mutual development objectives. However, this commitment to sustainability and localization is not limited to our investments in South Africa. Over the last few years, the U.S. government has been increasing its direct health investments in local systems and in local partners throughout the Southern African region. Over this past year alone, the U.S. government has invested over $800 million. What's the math on that? 800 times 18 or 17 is a lot of rand, right? several billion, in health systems across Southern Africa, including $335 million in the countries that border South Africa. Of this, 40% has been invested directly in local partners to support HIV/AIDS services, COVID-19 support, malaria, and other health systems. As leaders in health, South African organizations have been critical partners in our efforts to support health systems throughout the region. Leveraging their experience, the US government has partnered directly with South African-based organizations to support HIV testing and treatment services, to prevent mother-to-mother child transmission of HIV, and to strengthen COVID-19 related health systems throughout the Southern African region. Continuing these efforts towards sustainability and localization are cornerstones of the US government's assistance in investments and of the Biden administration's commitments to promoting diversity, equity, inclusion, and accessibility. We recognize that by partnering directly with local organizations, we can further the goal of making our aid more accessible and equitable by supporting organizations that represent the communities we aim to serve, including women, girls, marginalized groups, indigenous communities, LGBTQI plus people, persons with disabilities, and racial, ethnic, and religious minorities. Moving forward, we remain committed to expanding our local partnerships, including increasing our investments to local governments, with the intent of making our aid more accessible and its impact more equitable. This includes looking beyond HIV and working directly with local partners on future global health threats. This can be seen already with our investments in local partners and governments as part of the US government's COVID-19 response. Through the Global Facts Initiative, we have supported the national, provincial, and district departments of health to administer nearly 37.5 million COVID-19 vaccinations here in South Africa alone, 78% of which were implemented and driven by local partners. And fundamental to achieving this goal will be integration and collaboration with the already existing networks of care built over the last 20 years in PEPFAR's response to HIV. PEPFAR is one of the most successful programs in the history of the US government, I would argue in the history of any government, saving millions of lives since its inception. Through PEPFAR, nearly 20 million people are receiving life-saving treatment and millions more are receiving HIV preventative services and treatment for tuberculosis. Millions of adolescent girls, young women, and other youths are getting the support they need to ensure an AIDS-free future across the globe. Let me turn away from my prepared remarks for a second to emphasize this point. Those of you who are South African, who have been here, who were adults 30 years ago, 20 years ago, well recall the plight of the HIV/AIDS pandemic at its worst. You remember orphans raising their younger brothers and sisters because their parents are dead. You remember the tiny baby and child-sized coffins that were produced in the townships. You remember thinking, is there no end to this plague of biblical proportions? And as a direct result of the partnership not only between the people, the government of South Africa and the government of the United States of America, but the people of the United States of America and the people of South Africa, those dark days are a thing of the past. It does not mean that we are out of the woods as we continue to try to get everybody to know their HIV status and to get on PrEP. But it does mean, as Madiba once said, it is impossible until it is done. And we take inspiration for how far we've come in that fight to apply to the fights that are yet ahead of us all. Back to our regular programming. We could not have achieved such success without local partnerships and the dedicated work of local NGOs, CSOs, FBOs, other O's, and government partners. You only need to look around the room and see this commitment to local partnership in action. In this room, we have representatives from over 175 local organizations from 37 different countries. And there are many more of you that are participating virtually. You are the heart of this success. And we thank you for the hard work you've already done and the hard work that is yet to come. So I encourage you attendees from across the globe to use this opportunity this week to connect, share best practices, to network and build alliances that can help us achieve sustained HIV epidemic control by 2030. Now, as I conclude, let me share some personal thoughts, more personal thoughts, if I may. As Melissa mentioned, I hail from Jacksonville, Florida. I'm a multi-generation native Floridian. It's a rare thing. My father, Reuben Brigady Sr., which is where the second comes from, was able to attend Morehouse College in Atlanta, Georgia. He grew up during the period of Jim Crow, America's version of apartheid. And when he was a junior in Morehouse College, he became one of the very first volunteers with Operation Crossroads Africa and spent a year in what was then Northern Rhodesia, now Zambia, where he helped to build a hospital, St. Elizabeth Hospital in Katete Province. It still stands. After leaving Morehouse, he went back to our native Florida to enroll in medical school at the University of Florida Medical School. Only one problem: no black person had ever enrolled, let alone graduated from the University of Florida Medical School. He was the first, graduated in 1970. Some 30-odd years later, I met a beautiful Ethiopian medical student in Charleston, South Carolina, when I was a dashing young naval officer. We met, we're married. She became a medical physician herself and a medical doctor herself, and is currently a double board certified intensive care physician. And as such, she was on the front lines of the COVID epidemic in the United States. She's specially trained in ventilator management. And so the reason I tell you this is that respect for the healing arts is in my blood. And I believe deeply in the human dignity that comes from alleviating physical suffering, from curing disease, and for creating a pathway for a healthy life for everybody. I bring that passion with me into the office of the U.S. Ambassador to the Republic of South Africa. And I can promise you that you will feel this partnership through our USAID and other U.S. agency colleagues as we continue to work together in the spirit of Ubuntu to bring the healing dignity to all that we service. Thank you all so very much, and God bless you.
Wow, wasn't that an amazing speech? Absolutely fantastic. Actually, a rock star audience, which means that it requires rock star leaders to come, and I am absolutely ecstatic to introduce our next rock star. And that is Mr. Clinton White, who serves as our agency, USAID's counselor. He has more than 20 years of experience in the public sector and is a member of the Senior Foreign Service. Prior to this assignment, and I think he's been in his position for less than 6 months, if I'm not mistaken. Mr. White was with the Barbados-based USAID mission in the Eastern and Southern Caribbean. In September 2019, he served there as the regional representative, and he assumed leadership of the mission's portfolio in the Organization of the Eastern Caribbean States, and Barbados, and Guyana, Suriname, Trinidad and Tobago, and the Bahamas. He worked on an array of development issues. ESC region directly supports U.S. foreign policy priorities, fortifying efforts to stem crime and violence, promoting sustainable development, addressing food security, building resilience to natural disasters and climate change. Mr. White also served as a senior development advisor for USAID Libya, where he served where he was responsible for leading the mission on advancing economic development, democracy, and governance, and stabilization programs. He previously served as the Deputy Assistant Administrator in the Management Bureau, helping to advance key management and operational reforms. During his career, he has also served overseas as a USAID regional controller, directing financial management and operations in numerous missions, including Egypt, Pakistan, Senegal, and Ghana. Mr. White's career also includes working with national and municipal governments, as well as a range of private sector and civil society groups, including those representing women, youth, and marginalized communities in their efforts to improve the lives of families, communities, and countries. He is committed to the goals of diversity, equity, inclusion, and accessibility. Mr. White has championed partnerships between USAID and our nation's historic Black colleges and universities, helping the agency inspired purpose-driven engagement to tackle some of the world's most vexing development and humanitarian challenges. Mr. White holds a BS in business from the University of West Florida and an MBA from the University of West Florida. He studied organizational development and leadership at the University of West Florida, as well as public financial management at Duke University. In my tenure as a senior foreign service officer in the DAA in the Bureau of Global Health, I can tell you personally how much I value Mr. White and his leadership as the counselor of this agency. He is extraordinary, and I am so pleased that he is with us today. Over to you, Clinton.
Good afternoon, everyone. I hope you can hear me. I do want to thank you, Melissa, for those kind opening remarks. As always, it's so great to see you, and always so great to be able to work with you in any capacity. Also, I just want to extend a warm greetings to all of you, all of our partners there, our USAID colleagues, guests, friends. I've had the pleasure of being able to travel on TDY to South Africa several times early in my career and later in my career, and always had a great opportunity to work there in that mission, as well as get out and visit the programs and activities that we have and see all of the great work that's being achieved there and in that great mission. It's a pleasure to speak to you today about the U.S. Agency for International Development's approach to sustainable development. We are on an exciting trajectory informed by years of lessons learned from localization efforts across USAID, including our global health. From partners in Tanzania working to prevent child and maternal deaths, to partners in Jamaica working to control the HIV/AIDS epidemic, to our partners in Indonesia who are combating infectious diseases, and our partners there in South Africa, doing all of the work that you have been doing on HIV/AIDS as well. We are inspired by all of your work that is driving local change processes. Responses to global challenges must build on the priorities, knowledge, and aspirations of those who live them every day and know them best. That's why we are looking to work more with and shift more resources to local actors like you, as well as to expand the space for local actors to exercise leadership throughout all phases of our programming, from setting priorities to designing activities, to implementing projects, to measuring results. We believe this is the route to greater equity, effectiveness, and sustainability. So we're embracing localization, a word we use to refer to the set of actions, reforms, and behavior changes we, as an institution, will undertake to make our work, puts local actors in the lead, strengthens local systems, and is responsive to local communities. Through localization, we will expand our engagement with a range of local actors, from local civil society groups, including non-governmental and faith-based organizations, to local businesses, to subnational government entities. And we will do so through an inclusive development lens, ensuring that all people, including those who are marginalized or underrepresented, are fully included and can actively participate in and benefit from local development processes. Your work matters greatly, and we have learned and will continue to learn from you. When USAID Administrator Samantha Power met with this group last year, she heard your questions and concerns, and she heard about the progress taking place when local actors are in the lead, when local systems are strengthened, and when our partnerships are truly responsive to local communities. The administrator sends her best wishes for a successful meeting, and she and I wish we were able to join you in person for this event. We are eager to hear what emerges from your time together. I know the agenda for this meeting is quite full, and I encourage you to actively participate in the local partner feedback sessions on Thursdays. These sessions are the best opportunity to share your feedback to USAID on how we can work better together. And we commit to using your key points in our continued engagement within the agency on how we can work differently. As such, USAID is already profoundly changing the way we do business to better support locally led development and local actors. Let me quickly run through some of the many ways in which we are doing this. First, we are adapting our policies and our programs to foster locally led development that is tied to each country's unique political, social, cultural, economic, and environmental conditions. Let me be specific about some of the ways we are supporting this from Washington. We're working to make ourselves more accessible to local actors, whether that's by providing more information about how to partner with USAID through a new online platform called workwithusaid.org, by offering more information and opportunities for engagement in local languages, simplifying processes and mechanisms, or conducting outreach to local actors. We will soon also be releasing an updated acquisition and assistance strategy to emphasize simplified processes and flexible approaches that make it easier for new and local partners to engage with us. We recently revised the agency risk appetite statement to highlight that we are ready to make smart and disciplined risks when it comes to working with local partners. And we have published the first of its kind local capacity strengthening policy to establish agency-wide principles centered around the priorities. Second, we are shifting power to local actors, including those from marginalized and underrepresented groups, and promoting space for them to influence and exercise leadership over where, how, and why we collaborate to advance development outcomes. We are taking steps to ensure that by 2030, 50% of our programming will place local communities in the lead. And third, we are channeling a large portion of funding directly to local partners while ensuring accountability for the appropriate use of funds and achievement of development results. The launch of the website workwithusaid.org contains a partner directory that can help connect local, new, and traditional organizations that might want to form prime, sub, and consortium partnerships to compete for USAID awards. This site can be a valuable resource to you and others in your networks, as it also provides clear and accessible information with key documents in multiple languages on how to navigate working with the agency. At its core, the efforts we are taking at USAID to advance localization is about changing relationships and power dynamics so that local actors are at the center of our work. Our localization efforts are about who we fund, but their efforts are about who we fund, but they're about more than that as well. Fundamentally, localization is about how we work to combat the backsliding of peace, democracy, and human rights, rising food insecurity, the impacts of the climate crisis, the erosion of the global health, and more. Localization offers the best chance of achieving sustainable results. You are doing an incredible work around the world to make individuals and communities healthier. The American people support you in driving continued local change. And I want to thank you again for this opportunity. Stay well and take care. Thank you.
Lindsay's got me working today. Hello, everyone. So great to see your faces. It's wonderful to be here in person with all of you. And to those who are online, we miss you. We wish you were here. So again, my name is Melissa Jones, and I am one of the DAAs in the Bureau for Global Health. And what we heard was the ambassador's amazing opening, followed by my friend, the counselor of USAID's, really laying the landscape of the agency and our direction. So I want to talk to you a little bit about global health, the Global Health Bureau, and then for us to talk more as the day go on about all of you and your work, and for us to learn from each other. So in global health, we work in more than 80 countries, all across the world. And so much of our work is driven by three important pillars. One is to prevent child and maternal deaths. The second is to control the HIV epidemic, and then to combat infectious diseases. Now, of course, we can't do this alone. The fact of the matter is that you all lead us in that effort. We have a new vision in the Bureau, and I'd like to read it because it's really, to me, important. It was developed under my tenure, so I love it. We are an inclusive, agile, and innovative team, co-investing resources and expertise with communities and countries to advance the equitable delivery of sustained public health approaches, improving lives everywhere. Every single word that's in that small little statement, where community sits in that statement, is so, so important. You all are our experts. You all are on the front line of every everything that we do. And we do it together. So our impacts in global health has been fantastic over the last half century. We've seen a drop in under 5 mortality. It's fallen by 36%. Total deaths have fallen by more than half, and AIDS-related deaths have fallen by 33% since 2010. Now, how did we do this? How did that happen, do you ask? Well, let me give you a couple of examples of how it has happened. It has happened by the extraordinary leadership of local institutions. It has happened by people like yourselves. 2 examples that I'd like to share with you is BRAC, which is the Bangladesh Rural Committee, and Advancement Committee, and JCRC, which you all probably know well, which is the Joint Clinical Research Center. BRAC was founded in 1972 and has been playing a leading role, firstly in Bangladesh and now around the world. BRAC currently has operations in 11 countries, 4 in Asia and 7 in Africa. They started as a small organization in Bangladesh and has now expanded across the world. Their work is in WASH, education, agriculture, economic growth, human rights, entrepreneurship, disaster risk management, gender justice, diversity, and the list goes on. I have had the good fortune of spending 4 years in Bangladesh, and BRAC was in every conversation that we had. BRAC was the organization that we all tried to emulate. It's also, similarly, the Joint Clinical Research Center, with their pioneer use of antiretroviral drugs in Uganda in the 90s, has helped hundreds and thousands of Ugandans receive antiretroviral treatment and helped them stay on treatment. But now they're also expanding their efforts. They're working not only in HIV, but they are doing work in cardiovascular disease, COVID-19, they're supporting TB, sickle cell disease, and so much more. These are just 2 examples of the extraordinary leadership of local organizations. But we need to do more. What we've learned and what we are, I would say, somewhat saddened by is that we've seen tremendous gains in global health, but total death rates have rose in 2020, 2021, and 2022. The increase was a result not only of direct COVID deaths, but also of other preventable deaths from people who could not get to the clinic or adequate care during the pandemic. We need to invest more in the health system, make health systems stronger, and we need to invest more in communities. There is no question in our minds in global health that the community is the first line of support. So we are moving away from silos. We want to ensure that all of you get the tools you need to ensure that the beneficiaries receive the support that they need. And a part of that is our support on primary health care. Primary health care-oriented health systems are anchored by a strong health care workforce, can improve life expectancy, strengthen our health systems, and ensure more equity. We need to be more flexible in our funding and in our approach and our support to all of you. The majority of services and public health functions supported by local partners such as yourselves and USAID's global health programs intersect across various points of service for targeted demographic groups across the lifespan. We need to address the issues of newborn care, maternal health, adolescent care, non-communicable disease care, and across the entire lifespan is what we want to do. So in the Bureau, we have renewed focus on primary health care, especially at the community level. And this is an opportunity for us to strengthen and deepen our partnership with all of you. So, at the heart of our work is localization. It is our vision for development. There's so much that we're doing to diversify our partnerships, to be more responsive to people's needs and feedback, and to ensure, as I mentioned, equity. Our administrator, in her famous speech last year at Georgetown, called for our increased efforts and support to local partners. I want to just mention that we have highlighted our local capacity strengthening policy, which was launched on October 19th, and it demonstrates our commitment to partners and you all as local organizations. The policy lays out 7 principles in capacity strengthening, starting with the local systems, strengthening diverse capacities through diverse approaches, planning for and measuring performance. The other 4 principles are focused on ensuring we have equitable partnerships. They include aligning capacity strengthening with local priorities, appreciating and building on existing capacities, and being mindful of unintended consequences, and then practicing mutuality. So, I want to leave you with this thought. Where would we be without you? Where would this epidemic be without you? Please remember how important you are. The work that you do is important not only in the countries, in the communities that you work, but it's important to the world. So we thank you at the Bureau of Global Health, and I want you to spend one moment thanking each other. Those of you in this room, turn to your colleague next to you and just offer a word of appreciation. Thank you. Thank you.
Need something? Oh, perfect. Okay. I think it might be I think yes. Thank you. Thank you so much, Melissa. Let's give a round of applause for Melissa. Thank you. Okay, so we have the proper slides up. I feel a little bit better, and I realize that I didn't introduce myself. I'm introducing everyone else. My name is Lindsay Bonanno. I'm a health science specialist with the Office of HIV/AIDS in Washington, and I'm leading the coordination of this meeting, so I'm so excited that everybody made it here. So just wanted to, again, welcome you all. Our next event is that we will have a video welcome from the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy, Ambassador John Nkingasong. We can play the video.
Thank you for the opportunity to be part of this important conversation and dialogue. If you all recall, At the UN General Assembly meeting in New York just a few weeks ago, I did release the strategic direction, what we are calling the 5x3 pillars that will guide PEPFAR programming in the next couple of years. They include knowing the gaps, the inequity gaps, and closing the gaps with respect to priority populations, that is children, adolescent girls, and young women, and key population. It also includes finding ways to sustain the response that we have very successfully over the last close to 20 years as PEPFAR program or PEPFAR family roll out treatment programs and prevention programs in the countries that we support. And we need to look at sustainability in the lens of political sustainability, programmatic sustainability, and financial sustainability. We also laid emphasis on strengthening health systems that are required to deliver services. As I've said in the past, health system strengthening, and in this case, public health system strengthening is meaningless if they do not support service delivery. And service delivery themselves are not very meaningful if there are not systems or public health systems to deliver them. We're also looking at effective partnerships that will enable us to address the inequity gaps that I just outlined, and leading with science. The three enablers include leading with data, which will continue to use data and evidence-based approaches to focus our program, like a laser beam, so that we deploy resources efficiently in those populations that are most needed. And of course, community leadership and innovation. That is what we mean by 5x3. Now, let me just focus for a while on the second pillar, which is the sustaining the response, and perhaps the third pillar, which is public health systems strengthening. We have, over the last 20 years, recognized that a lot of progress has been made with partner countries, but we need to be very deliberate and intentional in recognizing that it's not enough to support government entities, but also local partners. The whole concept of localization, which means we enable local partners, facilitate them, empower them so that they can lead the response, such that when this program, that is PEPFAR, comes to an end, we should be able to leave behind indigenous local partners that can continue to work with other parties and the government of the host country to drive the response. That is the whole concept of localization. And I'm very pleased with the progress that has been made so far. When I came to this program, I understand that at least the target was to make sure that 70% of the funding goes to local partners, or what I call indigenous partners. We will be working with all our agencies to come out with a standard way of looking at localization that will enable us to be very objective in the way that we strengthen them, enable them, and capacitate them to continue to respond to the HIV threat. We believe strongly that unless and until these partners are fully strengthened in a measured manner, there will continue to be gaps. And if we do it right, they will become a significant assets for us in the future to responding to HIV/AIDS and bringing it to an end as a public health threat by the year 2030. And those same platforms, i.e. the local partners, will be also available in times of other emerging infectious diseases, such as the COVID response we've seen, we'll continue to see, monkeypox outbreak, and currently the Ebola outbreak in Uganda. I've seen firsthand, and in my own personal experience, how the power of local partners, especially during the COVID response, where it became almost impossible for international organizations to fly into a country and provide that support. The partners that were on the ground made a significant difference. They were the determining factor in the way that we respond adequately to the COVID-19 pandemic or fail to respond adequately. So I come to this conversation with a very personal experience and a very strong passion that together as a PEPFAR family and USG, we can do better. Worked in such a way that the partners that we develop, strengthen, can be used in leveraging other donors, such as the Global Fund, the European Union, community, and other bilateral donors. So this is an exciting time personally for me, and I look forward to working with you all as we journey in this pathway. Thank you all for the opportunity for allowing me to contribute and share a few remarks.
Thank you very much to the ambassador. I would like to now introduce our next speaker, Dr. Han Kang, who serves as the director of the Office of HIV/AIDS with USAID in Washington, D.C. Han previously served as the acting deputy mission director for USAID Burma and led USAID health teams in Burma, Ethiopia, Nepal, Nigeria, Pakistan, South Sudan, and Zambia. Before joining USAID in 2007, he worked with the United States Centers for Disease Control and Prevention to investigate and control disease outbreaks in the United States-Mexico border region. Han has co-authored a book on HIV/AIDS in South Asia and articles on global health and development. He began his career by providing HIV/AIDS care in clinics serving ethnic minority communities. Welcome, Han. Thank you.
Dumela and Sani Bonani, and good afternoon to those of you in South Africa. And to our participants joining online, good morning, good afternoon, and good evening. I'm delighted to be here with all of you. So I arrived in South Africa 2 weeks ago, and one of the first things that I did was to actually visit 2 clinics, one in Yaleville, the other one in Hillbrow, supported by Dr. Moya and her team at ANOVA, and I witnessed firsthand the impact that this particular organization had in delivering HIV care. And if we consider collectively the efforts of all of what you have done in the HIV/AIDS response, this is what we see in the data. So for those of you who are from the 11 countries that have achieved epidemic control, congratulations. And thank you. And as Ambassador Brigady shared with all of us, we are not out of the woods. What I see here is that we can do more to reduce the number of new HIV infections. So while this is a great day of celebration, and we will do it again on World AIDS Day, let us also recommit ourselves to a shared mission with a focus on reducing the new HIV infections. What also got me started in public health was when I was applying for a scholarship to study at the London School of Hygiene and Tropical Medicine. I think some of you may have studied there as well. And I remember the interview panelists asking me, what would you do if HIV/AIDS were eradicated? And what I told the panelists was that I would continue to address the inequities and injustices that manifest in epidemics, and we can see that right here. This is the reason why, as our Deputy Assistant Administrator, Melissa Jones, mentioned, we put health equity and inclusion front and center in the work that we do in the Bureau for Global Health and in the Office of HIV/AIDS. It is also the reason why we, as USAID, we have appointed Jesse Patterson and Tamara Cox to co-lead our efforts on local partnerships. And I hope that all of you will have a chance to meet both of them. They are both here in this meeting, so please take the opportunity during the reception and throughout the time to meet them and speak with them and to share your successes and to also share your lessons. It's also the reason why we need all of you as local partners, because as we've discussed, you have the reach and you have the unique insights that will show what we need to do in order to truly achieve epidemic control. Now, as we continue to invest, to co-invest in treatment as prevention, we really need you to reach that last mile. And the way that Ambassador Nkenkazong would define last mile, it's not necessarily just the most remote or rural place on earth. What it refers to is people who still do not recognize their risk for HIV, but they may be living with HIV. And so we need you and your efforts to help them get diagnosed and to get treated. Well over half of people living with HIV are alive today because of your accomplishments in testing, in treatment, and tuberculosis preventive therapy. And thank you. And for those people who test negative, you've helped them remain HIV-free by introducing and expanding access to pre-exposure prophylaxis. Thank you for that. The results that you saw in the 2 previous slides represents what our Administrator Power, would say, this is progress beyond programs. Underlying such progress is the continuous growth in the amount and the proportion of USAID funding for the HIV/AIDS response that represents a co-investment in the response through local partners, and we continue to project such growth into the future. USAID has contributed to the HIV/AIDS response in our partner countries, and this contribution builds on a history of activism in the United States. Some of you may recall the posters, and it was an iconic political poster, "Silence equals death." So our intent in growing local partnerships is to elevate your voice. It's to elevate your visibility to give life. And I will always remember the theme of the very first International AIDS Conference that was held in the African region in 2000 and in Durban, and that theme was "Break the Silence." And that is exactly what we're asking you to do. So let me showcase some examples of local organizations. I think many of you are here as to how you've broken the silence. So to PASMO, muchísimas gracias. Thank you very much. You have done wonders in elevating the voices and the visibility of key populations in Central America. To Nweti from Mozambique. Muito obrigado. Really, thank you very much for elevating the voices and visibility of adolescent girls and young women to ensure that they are determined, resilient, empowered, AIDS-free, mentored, and safe. And that is the intent of the DREAMS program under PEPFAR. To the Catholic Medical Mission Board from Zambia. Okay. Zikomo, thank you very much for elevating orphans, vulnerable children, and their caregivers in your work. And to the Life Center in Vietnam. Thank you also for your work in elevating the voices and visibility of key populations in the country. As we heard from Ambassador Nkengazong, the PEPFAR strategic direction that was launched in September is showcased here with the 5 pillars and the 3 enablers. Local partners, all of you, have roles in each of the pillars and each of the enablers. USAID's implementation of the PEPFAR strategic direction will be the Agency HIV Optimization Plan, also known as the AHOP. It represents USAID's global strategy, and it's aligned with the PEPFAR strategic direction and the forthcoming strategic plan. What I'm going to do now is to share some examples of how local partners can play a role in each of the pathways toward ending the AIDS epidemic as a public health threat by 2030. So as an example, pathway 3. In terms of our work with government-to-government awards, as an agency, we are not limited to the national line ministries of health, really as shown by this example in Malawi. We can partner at the subnational level. We can partner with departments or ministries beyond the health sector. We can also partner with local universities because we recognize that all of these institutions and entities play an important role in the HIV/AIDS response. For Pathway 4, USAID aims to support local firms to produce quality-assured, life-saving products. We see this important for global health security, and it's also an important employment opportunity for youth, as South Africa has already done through the Medical Research Council in partnership with local biotechnology and pharmaceutical firms. And in Pathway 5, as our Deputy Assistant Administrator, Melissa, mentioned, communities are at the heart of our vision for the Bureau for Global Health, but they're also at the heart of where you are as local organizations. Because you are in the front line, you will be the first to detect the next pandemic threat. And we recognize your expertise in risk communication, in community engagement, in service delivery, and we want to take full advantage of that so that we prevent the next COVID-19. Diversity, equity, inclusion, and accessibility. These are the terms that I associate with local partners. We can always learn more, we can do better, and we can be stronger when we're actually working together. And so that is why through this meeting, we are recommitting ourselves as an agency to locally led development through local partnerships. Working together to end the AIDS epidemic as a public health threat by 2030, it calls for a recognition of key populations and people living with HIV as people, not as criminals, not as individuals who have to struggle with stigma and discrimination. So part of our partnership with all of you is to help you advocate for the legal and policy reforms that are necessary in order to expand access for members of key populations as well as people living with HIV. So once again, I thank you for the progress that we've made together to date. We still have work ahead of us. The job is not done, but I am 100% confident that we will get this done together through our local partnerships as we fulfill our shared promise and our shared purpose, again, in ending the AIDS epidemic by 2030 as envisioned by the United Nations. And we all have a role, and we look forward to working with all of you, and I look forward to meeting each of you throughout the week.
Thank you, Han. Thank you very much. I think we now will be moving on to our exciting panel for our panelists. So I would like to welcome Melissa to come back to the stage, to continuing your work with our esteemed panelists who are sitting hopefully in the front and can easily get up here to talk through their perspectives on why localization matters. So please, Darisha, Steve, Dr. Chinyanga. You can come up this side, maybe. Yeah.
So I'm absolutely thrilled to have this panel, and I think you all will be too. So I would like to introduce the panelists. First, we have Darisha Naidu, who is the health, you're the chief of party for APAS, right? Program at Broadreach Health Development Organization in South Africa. Ms. Naidu's compassionate and skilled leadership, Broadreach is a top performing partner in South Africa. Under her leadership, Ugu in KwaZulu-Natal became South Africa's first district to reach 90-90-90. Extraordinary. And that was done in 2019. Ms. Naidu is also a publisher. She's published research. She's an author and also a popular media spokesperson. Currently, your organization has about 500,000 people on treatment. Is that correct? Amazing. Absolutely amazing. And as I understand, your organization is about 1,000 people working, staff. Amazing. Absolutely extraordinary. The next person that we have on our panel, and please do, we have Tinashe Chinyanga, who's the executive director of Organization for Public Health Interventions and Development in Zimbabwe. Dr. Chinyanga oversees the implementation of OPHID's donor-funded programs. Over the past 12 years, he served in various capacities within NGOs, implementing PEPFAR USAID-funded HIV programs in Lesotho, South Africa, and Zimbabwe. The next person that we have, I'm going back onto my papers here, is Steve Laguerre. And Steve Laguerre is the project director at ECP2, implemented by the Foundation for Service in Haiti. Is that correct? He has more than 15 years of experience working in HIV programming and he holds a master's degree in communication and development from the University of Montreal. And then online, I am thrilled that Taslim Uddin Khan is the managing director and CEO for the social marketing company in Bangladesh. I've had the good fortune to working with Taslim directly. He has more than 33 years of experience and leads the design, development, and implementation of a large nationwide health and family planning program, which includes building networks for health providers to offer public health services, implementing behavior change communication and community mobilization activities, marketing of public health products and contraceptives, and implementing them at health clinics. Welcome, Taslim. Okay, so panelists, thank you. Thank you so much. Here is my first question to all of you. And you've got about 3 minutes to tell us. So can you tell us about the needs in the community that led you to found your organization? Let's start at the end.
Thanks so much, Melissa, for that question. So the Broadreach Health Development is part of the Broadreach Group that was founded in 2003 by best friends and doctors, Dr. John Sargent and Dr. Ernest Darcourt. And it really was about a deep commitment towards achieving health equity, as well as having a belief that in order for people to flourish, you need good access to health care. Broadreach has been implementing programs in over 25 countries. And what our programs really have in common is that there is a commitment to local partnership, it's innovation-led, and it's data-centric. So it allows our teams to actually be empowered so that they are able to then have direct positive impact on our clients, which are our patients. Broadreach has been working with USAID since 2005 in South Africa. Thanks.
Thank you. Good afternoon all. So OFID, as we call it, the Organization for Public Health Interventions and Development, we use the acronym OPHID. It was founded in 2001. I was in second year medical school at that time. So there was a need. All I knew at that time, I didn't know OFID. People were dying of HIV. And there was no ARV program at that time. But the need to support people living with HIV was there. And the organization was founded as an outpost of the University of Bordeaux Institute of Public Health. So it started off as ISPED. And as the ART program started around 2004, the need to support technical assistance with the Ministry of Health was there. More hands were needed on the deck. People were dying. And as the program also evolved, for those of us who have been in ARV programs, we know we started off with CD4 200. We went to CD4 500, you know, and we went to TRITO. And the number of people in need of treatment kept growing bigger and bigger. And so the need to provide technical assistance was there, and to provide the hands on the deck to provide the actual services within the clinics was there. So that's what led to the growth of the organization. And the conversation for localization started in 2012, around 2010, and OFID became a local organization around 2011, and in 2012 received its first Prime Award, 60 million over 5 years, and it ended up being 70 million over 8 years. So we have been in the game for a long time as a Prime with subs for 10 years now. Thank you.
Thank you for the question. Fondation Zero V, it's a local organization that is based in Port-au-Prince, Haiti. We created Fondation Zero V back in 1999 during my first visit in Haiti. And I was questioning my friends around, asking them what was available for the gay community regarding prevention, and no one could answer. I was wondering where they were getting the condoms, and no one could provide an answer. They were either going to some centers that were managed by the Ministry of Health to provide, to get the condoms, but when they were reaching these centers, all sorts of bizarre questions were asked to them about why they need the condoms, why are they sexually active, and that's why I decided to reach also the Ministry of Health to know exactly what was happening for the gay community back on the island. And their answer was, well, nothing. We don't know how to reach them. We don't even know if we have gay people in Haiti. So that was their answer. And that's when I decided, a group of friends and myself, to engage and created Fondation Zero V. Like I always said when we started, we started in my garage. We were four that was working solely in the Western Department in Port-au-Prince. We have now 18 clinics nationwide that is serving more than 60,000 people. We have approximately 15,000 people on PrEP, and on ARV, maybe 18,000 on ARV. So we started from a program that was receiving $6,000 from FHI 360 to now 4 million from USAID Haiti. Thank you.
Thank you so much. Taslim.
Thank you, my mentor, Melissa Jones, and greetings from Dhaka, everybody. I should start in that way. In 1971, we got our liberation. And then after 3 years of our liberation, independence, and then in 1974, SMC initiated its activities. That time, the community level, as far as family planning is concerned, total fertility rate was 6.8 per family that time. So we have started our activities first to address the rapid population growth, and that was in 1975 with USAID support. Since then, we have unbroken partnership with USAID, and that time there was a tripartite agreement between USAID and an international organization, PSI, and Bangladesh government. And then another issue I mean raised, which is childhood diarrhea. It was #1 killer disease at that time when we started our ORS program. And then nutrition is another issue which which country need a lot of attention, and SMC work as an integral partner to address the nutrition issues. So these are the, and adolescent is another one where we need to, we had our activities that time, and country need support and services in that area. So these are the major area where we are working. We are working with USAID. We have partnership, unbroken partnership over the last 48 years, and still we are working with significant contribution to the national level. Perhaps this question will be coming, and I want to stop here.
You guys hear me okay? Okay, super. So thank you so much. What I'm hearing from each one of you is about need, that you recognize the need in your communities, that you saw the harm that HIV was doing in your particular communities, and in the case of Bangladesh, throughout the entire health sector, not only for around cholera and diarrheal diseases in newborns, but also around nutrition needs and especially around the needs for contraceptives and family planning. You all three on the stage have really give us such a sense of passion for the work, and so much appreciate that. So Dirisha, this is the next question to you. Can you tell us about how you work with government as a partner and why that relationship is so critical?
Thanks so much, Melissa. So working with our Ministry of Health colleagues is absolutely critical, especially if you want to implement a large-scale project like ours and you have close to 1,000 staff that are out in the field implementing. So local knowledge and context, people come from the same communities that we're serving, is absolutely important. Understanding, having that contextual understanding of the policies, processes, protocols as we engage with our Department of Health colleagues has been critical to navigating some of Broadreach's success. One of the things that I have specifically been driving as the Chief of Party in our organization is we hold a quarterly Department of Health engagement session where I will convene with our provincial leadership from the Ministry of Health as well as the district leadership from Ministry of Health. And what we really do is we come together for a day or two where we can really sit and ensure that there's alignment at our levels. We will discuss those challenges, we talk about the best practices, we share across the different partners and portfolios, and then we plan together. So that has been critical because what we have seen is that if we are aligned at our level, it's easier for messages to then cascade down at the various different levels, especially at the level of implementation on the ground. So one of the key things, and I'll talk a little bit about this a bit later on, being able to work in the Ugu district for close to 15 years prior to that district achieving 90-90-90 was, all the success has been because of that working with Department of Health. That collaborative engagement, that walking side by side is what has really led to that success. Thanks.
Thank you so much for that. Here is the next question to Dr. Chinyanga. Can you share with us more details on your organization's journey transitioning from a sub-ward under the Elizabeth Glaser Pediatric AIDS Foundations to a prime awardee? And what were some of the things that worked well and things that didn't go well during that transition process?
Thank you. I think from the history of the organization, I think I would say there was a lot of USAID support through the process for the organization to localize and to actually build a strong local organization. The support was instrumental, and I can count it as one of the things that went well. There was also engagement with the government. The board engaged with the Ministry of Health to say, we are going to be a local organization now, and we are going to work closely together. We are a donor-funded organization, but we will be moving together. So the government was in on it, and things were going well. And I think the other success was there was a recognition within the organization that we need people who have done this before, people who have implemented these type of grants, and they were brought into the organization, which should probably happen with every local. Get someone with experience. The organization got these people who had implemented USAID programs. The chief of party had implemented with PEPFAR in multiple countries. She's now retired, but she was also instrumental. And a few others who had implemented this type of grants, they were brought to the organization. The policies were revised to align with the USAID rules and regulations. When you are moving from a local funded organization with no USAID funding, it's like moving from running a spaza shop to running a supermarket, right? So the things you need to run a spaza shop to a supermarket are very different. OFID was 20 people at the time of the transition to now 325 or 500 if we count the subs who receive probably 95% of their funding from OFID. So the things you need are very different. So there was that revision of the policies, the nuts and bolts of how are we going to run this supermarket. Those also went well. The policies were revised. But I think there are things that could have been done better. When I got there, I would say the grant agreement was a secret. It would be known by a few individuals within the organization, and I was like, share this thing. I was working at Right to Care before I went to Zimbabwe, so everyone must read the grant agreement, right? Even the budget has got levels. You know, if you want people to learn how to manage a budget, they have to start somewhere at their levels, right? So that also could have been done better. Yeah, I think also the other thing was the revision of the policies was not exhaustive, right? Because when you have the rules and regulations, the mandatory standard provisions are in the face of the agreement. The required as applicable provisions are in the face of the agreement. So the probably best approach would be to do a line by line. What must be in our written policies, and you just update it. Otherwise, you leave the organization exposed to the risk that you could have otherwise managed. So I think that's what I can say has been the journey so far, and the successes and the challenges. Thank you.
Thank you so much. Now, for Steve, first let me just say that our hearts go out to the people of Haiti during such a difficult time. Can you tell us, with such ongoing economic and humanitarian and security threats in Haiti, what are some strategies that your organization has used to continue to provide services to the community?
Okay. Thank you for the question. It is definitely a difficult period for Port-au-Prince, Haiti, where we do have more than 30 persons that are being kidnapped daily, rapes of travelers on the roads. There are no fuel available at the pump station. We started receiving fuel 3 days ago. So one, it was for us to see how we can provide the services in this difficult period. One was the energy situation, where we had to switch to solar energy, where it's very costly, and we had to review our agreement with USAID and see how we can provide energy to our sites. Secondly, I think it's important to mention that we have a strong presence in the communities through the peer educators, through the peer navigators, and also the staff that we have at these sites that are from the communities, and they are dedicating themselves to provide the services to our beneficiaries. So I definitely will say that it's the community presence that is one of our forte in the organization. And keep in mind that we're not solely providing services for the LGBTQI plus community, but also for sex workers and their clients. And we do have, extraordinary peers that are in these brothels and making sure that the services are available for their colleagues. Thank you.
Thank you so much. Taslim, how has your organization planned for sustainability? And does the thoughts of having no USAID money scare you?
Thank you for that question. In fact, we started in 1974, and that time sustainability agenda was very much focused. Even that when we initiated our activities, we started with distributing product, and product was not free. We took minimum price, very affordable price for the client. So that was the one thing for our sustainability element. And another thing was that we continued USAID support. We invested a lot to make the brand popular in the country. So that was really helpful for our sustainability planning process. And there was a transition process. Transition is when with USAID investment, when a product has become much popular, then USAID stopped funding for that product, and we took it by our own to continue that. And this is the way we passed through few decades. And in 2014, when we saw that many of our products is earning surplus revenue, then we thought that we should operate differently. Then in 2014, we developed our subsidiary social marketing enterprise, and they are earning, they are operating fully commercial. And SMC is a non-for-profit organization. Our subsidiary is earning money, and they are giving us money back in form of a dividend, and that we are plowing back for program implementation. So it's a completely different model, atypical model in the globe. And their income is increasing day by day, and this dividend is also increasing day by day. So that is one way of thinking to ensure the support. But even then, a product which needs still attention and focus and promotion as far as public health need is there. So that product, we are giving subsidy. So that is the way we process. Even USAID support, still we are getting donated product from USAID. For example, injectable contraceptive, implant, and IUD, and we are giving subsidy for that product, and trying to build the brand. And when the brand will be too much popular, then it will be maybe after 5 years it will be a transition process. Melissa, the second question you asked me, whether we are afraid of that, we feel scary. Answer is no, because SMC will exist. SMC enterprise is completely is running by their own way, and they are giving us dividend and resources to continue our work. The issue is not scary, but issue is, we with USAID support, we are contributing extensive contribution we are making as far as National Family Planning Program is concerned, health program is concerned of the country, child health program in the country. If we consider it in that way, that currently 38% of total contraception is coming from social marketing company. 25 years back, diarrheal disease was #1 killer disease, and now it is 5th or 6th due to our ORS. Nutrition is a big issue here, and our micronutrient powder is greatly contributing to reduce childhood nutrition. Our adolescent program is largely contributing to to increase contraceptive use among the adolescent, and also their knowledge for use sanitary napkin and health and hygiene practice. So these are the some of the things, and we are thinking in that way that if we have USAID money, more contribution, wider contribution we can make, but still without USAID support we can go, but the magnitude will be a little bit different. Thank you.
Thank you so much, Taslim. So what I'm hearing is a real theme across the panel. One is how important it is to have partnerships. Partnerships with government is extremely important, but also having partnerships with others who perhaps have gone through this process of being a sub-partner to then becoming a prime partner of USAID, learning from them, and with good leadership, explaining what the conditions of the partnership with USAID is, what the conditions and understanding the grants and the awards that you receive, what the expectations are. And then lastly, of having peers in the community, people in the community, invested in the community, is so important that we cannot achieve the results without being from the community. And that was fantastic, Steve, your explanation. And then finally, what I hear that you say, Taslim, is really the trust of the community, that you are delivering products of high quality and the community trusts those products. And because of that, you have developed a sustainable brand as social marketing. Fantastic. Here is my last question for all of you. I'm going to read 3 questions, and then each one of you could decide which one you'd like to answer. So can you describe some successes and challenges your organizations have faced in working with USAID? Or what advice do you have for partners who are just beginning their relationships with USAID? And then what can USAID do to improve the work with local partners? Let's start with Taslim. Taslim, please.
Yeah, thank you. Let me pick the success on. If we see our list of success, perhaps the audience will be happy to know that we are significant partner with the national program and government. For example, already I have mentioned that as far as family planning is concerned, it's 38%, 47% of oral contraceptive pill, 62% of condom, and 38% of injectable is our brand. Our ORS significantly contributed reduction of diarrheal disease in the country, and now childhood mortality reduced significantly in the country. Then nutrition, we are trying our best to improve the nutrition situation of the country. That's we call the life cycle approach, starting from exclusive breastfeeding for children under 5 to the pregnant mother. Children under 5 for micronutrient powder, and then micronutrient powder plus for adolescent, and then pregnant women for multiple micronutrient supplement. It's a new things to improve their nutrition condition. And then our deworming is for all family members. That is also significantly contributing to the nutrition. And then our sanitary napkin is the second largest sanitary napkin, second popular sanitary napkin, with very minimum price, affordable price, but ensuring highest level of quality. That type of things, we are doing, contributing. And one of the major things behind, beside our program activities service, that our network, we call is engagement of private sector provider, be it graduate and be it non-graduate medical practitioner. We engage them in the public health sector, and we have more than 18,000 that type of provider, graduate and non-graduate provider across the country, and they are significantly contributing in the national family planning and health sector of Bangladesh. And very closely we are working with government too. And it's a journey of over the last 48 years. We are trying, every day we are thinking what new we can do for the betterment of the people of this country. Our mission is very much in line with USAID mission, is to improve the health status of women, children, and families of the country. So that's the journey, and we are very much thankful for USAID for continued support.
Thank you so much. So we're going to do a round. We've got about 5 minutes left. So, Steve, any thoughts on those 3 questions?
Yes, I'll go with the success as well. The fact that I have 3 staff that are based at the Ministry of Health that are supporting them in developing policies, in helping them providing training to the various sites that we have in the country is one of our biggest success. The second is the fact that we are the lead organization in Haiti working with key populations with USAID, and it is recognized by all the actors in the country. So it is a success for us. And also the fact that I can hire qualified staff. When I'm talking qualified staff, it's medical doctors, it's accountant, it's audit specialists that can help us manage this this extraordinary grant that we received. So I think it's one of the success that we have within the organizations. Thank you.
Thank you. I like giving advice.
Please.
Okay. I will probably speak to those ones who are starting and probably those ones who have been local partners. You need to read the award. I think Doug Frank will say that again. And you need to understand the must, should, shall, right? Make sure that your policies are aligned with USAID rules and regulations. The policies make our organizations better because we don't get into anything that we have not thought through, right? When you are asked to submit your award, you submit 25 pages and you get 75 million. There is no way you could have written everything that you are going to do in 25 pages. Some people who have written the document need to now sit down and distill it into bite-sized chunks for the teams to say, this is what we were thinking. And based on our experience, this is what we think we should be doing on the ground. Right? Don't expect people who figure it out by themselves. They are nurses, they are doctors, but I assure you those things are not trained in medical school because I was also there. Right? The other thing is, most of your people who are going to be managing these programs are clinicians. There is no way where they have been taught how to manage people. 70 to 80% of your budget is human resources if you are implementing these programs. It's a service. Even though you can manage the 20% of the budget, your cost driver is human resources. You need to be able to capacitate your people to manage people and to make their decisions. And I always say this. My observation has been, if there are 10 people doing a job, 4 will do it with their intrinsic motivation. About 6 will require training. Of the 6, 3 will improve with training and these things that I'm talking about. But the 3, you need to do something extra, maybe performance improvement and all those things. And probably 1 or 2, you need to let go. But remember, the vision and the mission you are getting money for is to make sure people get access to treatment and remain healthy on treatment. in our program we have 320,000. We had 650,000. We can't compromise 320,000 because of one person, right? We are looking for some people will be able to do this and others will not be able to. It doesn't mean they are bad people. They just need to find something that they are good at doing. And those are the difficult decisions that need, and the difficult conversations that need to happen in a local organization. So, staff doesn't fail. I always say staff doesn't fail. It's the management who would have failed to either provide guidance or performance management. Thank you.
Very good, very good. I'm going to give the last few words to you, Darisha.
Thanks so much. So, I mean, that's great, Dr.
That's true, that's true.
And it's very true. But I think I also want to remind, new organizations that this is a truly incredible opportunity that you've been given. And there's no other way to do the life-changing work than to do the work that we do. So there's incredible, heartwarming feeling that I get when I have to talk about things like that. But it's just such a wonderful opportunity. I think the next piece is to say, it's to also have constructive conversations with the funder so that you understand each other and you know how to collaborate effectively. And then on the latter, the last question that you asked, and I believe this opportunity of bringing together local partners in this environment where we all able to share is an example of where we now take away the threat of competition amongst local partners. So having us engage as colleagues and learning from each other is a very effective way, to help this. And then the next piece is that we talk a lot about targets and performance, right? And once we get to move past the targets and performance, we need to understand that this program is beyond the numbers. It is about people. It's about the communities that we serve. So, those things are critical in order for us to be successful. And when I say us, I mean the collaborative us, because together, the impact that we have is far greater than what I or the organization that I work for can do on our own. So thanks so much.
Fantastic, fantastic. So I can't tell you how much this means to all of us for your participation and insight. And to all of those that are in the audience, please do spend time talking to your colleagues. Maybe not the ones that are on the stage, maybe they're across the room, maybe they're in a different country, but it's that networking, that connection that is so important. We want you to leave this week with understanding at least that you are not in it alone, that we need each other, and that USAID is your partner. With that, I want to thank you all. Taslim, thank you, sir. And everyone, have a lunch. Are we for lunch? Are we going?